Alright, hi guys, a very good evening to all of you, and welcome to our today's YouTube session, which is a very special class, especially for our MBBS students, those who are finishing their MBBS from the foreign countries. So once they are coming to India, there are a lot of questions that are running in their mind, that what are the different steps that they can take in establishing their career in the medical field. Apart from that, what are the other associated field that these students can go. So this will be a very short session in which I'll be talking very briefly about what are the different career options that you guys can choose. At any point of time, if you guys feel that you can use any of this career option, or you're more interested in that, do let us know in the comment section. We'll try to make a separate videos on each one of them. Although there are separate videos already in this area, in the different videos how to go for USMLE or PLAB. Apart from that, we will also be coming up with such videos. So before I start the session, please give me a quick confirmation if I'm clearly audible and visible to all of you guys. For all the students, those who are new, you can give your comments in the comment section. There is a live chat option that is going on your screen. You can simply type yes if everything is absolutely fine. Please give me a quick confirmation. Dr. Farhan Alam, welcome to the class, and all the other students. Please give a quick confirmation and then I will start immediately. Alright, all well, fine. Thank you very much. Now, the first question that is coming to all the students' mind, that what all career option that I can choose, what are the options do I have. So the very first question, usually I ask a cross question from the students. Okay, what is your aim? Where do you want to establish yourself? Are you looking for establishing yourself in abroad, or you're looking to abroad? You're looking to settle down in our country, in India, right? So first you get clear with these facts. If everything is clear, right, whether you want to go for abroad or India, definitely we can discuss more about that. Now, in the previous videos, what we have discussed actually, that what are the different options that you are having for the foreign countries or for the abroad. So we have, previously also some of our educators, they have already made videos on USMLE, where you have usually 3 steps, right? And few of the steps you can give it in India. Apart from that, some of the steps like clinical and all, you will have to appear once after reaching in that country. Likewise, PLAB is another for UK, where you will be having 2 steps, right? And for this, of course, IELTS and all will be definitely required. Then Australian Medical Council exam you can utilize. No doubt, utilizing your score of PLAB, you can also apply for Australian Medical Council, and vice versa. For after utilizing the USMLE score, you can also apply for GMC registration. So we'll be having a separate discussion on each one of them, how to approach for USMLE, how can you utilize your USMLE score for PLAB, or how can you utilize PLAB, how can you prepare for PLAB. For each one of them, we'll be having separate videos. Apart from that, for some students, those who wanted to settle down in other foreign countries like Dubai, you'll have to write their one of the very easy kind of examination, that is DHA examination. And there is another option that is open for the this is especially for our Indian graduates as well, which is PG in Germany. You can do your post graduation further studies in Germany, where you don't have to pay much as long as you are going to fulfill these criteria, like their language. So they have multiple language models like A1, A2, B1, B2, C1, C2. So you have to be proficient. You'll have to be very, very efficient in their language. Apart from that, they have a separate examination for medical terminology, and they also have their own entrance examination. So if you're going to qualify these 3 steps for the Germany, your education in Germany will be absolutely free. We'll have a separate video on each one of them, like how to approach for MLE, how to approach for PLAB, for the Australian Medical Council, DHA, or post graduation in Germany. Apart from that, you can also enlist other countries in which you can actually do the post graduation. The only thing that we know, that post graduation in Germany is not acceptable in our country, right? Usually from some countries like USA, Australia, UK, from only these 4-5 countries, the post graduation is acceptable in India. Apart from that, the German post graduation is actually not acceptable. So for abroad, these are the different options. Now for most of the students, as Dr. Shahbaz and other students are mentioning, that definitely they would like to discuss what are the things that they can do in our country, in India. So definitely we have multiple option. Now what is the traditional option? Any student who is coming from abroad, they will try to clear FMG, that is foreign medical graduate examination. After clearing the FMG, they will definitely like to follow the traditional pathway. And what is the traditional pathway which majority of the students, I would say, more than 50% of the students are following, that is preparing for NEET PG examination. Through this NEET PG examination, they can choose their post-graduation branch, their desired branch, right, in different NEET PG hospitals or different DNB hospitals. So for getting selected in DNB and also for the diploma, you have this examination. So utilizing this examination, you can get entry in any one of them. All the students, those who are preparing for NEET PG, they are also preparing for INICET, which is Institutes of National Importance Combined Entrance Examination, where this will combine the examination for AIMS, PGI and JIPMER. So these are the different institute in which you can take admission in the post-graduation program. So traditional, most of the students are trying to go for the residency program for their post-graduation program. Okay. Then other diploma courses are also there, that is DNB diploma, that has also been added. So in the upcoming years, we'll be getting more diploma seats. This year we have got multiple additions. Since this is not very particular area where we discuss how many seats has increased and what all branches that you can take, we are just trying to explore what are the different options that you have. So majority of the students, after clearing the examination, they are going for the diploma, the traditional pathway, which is NEET PG, DNB diploma, INICET or diploma courses. Apart from that, what else? Do we have something else apart from these traditional courses? Let's figure it out. I think the system is hanging. Just a minute, please. System is hanging actually. Just a minute, let me see. Now let me just speak by the time the system might respond. No. All right, so let me just continue with this one. I'll see if the system can respond in between. Apart from this, I have also seen most of the students, they are also trying to do their usual FMG. Once they are completed, once they are done with the FMG, they are trying to finish their internship, right? So they'll finish their internship in India and they usually apply for the registration, right? We will have a separate session also, that how can you apply for the registration in different states and how can you make it very, very easy, right? Especially for our FMG students. Then most of the students, they are actually applying, or joining as a junior residents in different hospitals. Like most of the students, if you go to AIMS Trauma Center, most of the students will be from FMG, or there will be Indian graduates as well, but you can find a lot of FMG students working in AIMS, RML Hospital or Safdarjung Hospital, or in any other states. I'm talking about the Delhi, but in any other state you can even apply for this residency. Just remember, this junior residency program that I'm talking about, which you are going to apply in the different state, is actually a temporary kind of job where you can learn some skills, or you can earn some part-time. It will not be a part-time job, but definitely it's an 8-hour job, and you're going to earn, like, let's say somewhere between around 90 to 1 lakh rupees per month in these jobs. But remember, these are just temporary job, and you'll be hired for a period of, let's say, 6 months to 1 year, and after that you'll have to apply again for the different institute or different hospital. Now, apart from this, what most of the students are also doing was they are learning some of the skills in these areas. They are also going for doing private practice, right? Private practice. I have some slides. Let me see if I can help you. I don't know why this system has hanged actually. Let me try to close it up. Sorry about this. Extremely sorry. Extremely sorry. Okay, I think we can continue from here. As I was telling you that in India we have the traditional ways, and where most of the students, apart from going into their usual, NEET PG step, they also opt for after finishing their internship, they will apply for getting the registration done. And once they are done with the registration, they usually join as a junior resident. So that is also one of the option, part-time option, or I would say option for very short period of time where you can learn some of the important skills. Undoubtedly, you'll be learning your skills if you're going to work in your internship as well. So that's a totally different scenario where you will be posted in different branches. But here, during the residency, junior residency, you can choose your branch of choice. If you're interested in, let's say, pathology, or if you're interested, let's say, in emergency medicine, most of the time I have seen the residents are getting in emergency medicine, or sometime they can get in pediatrics. There are also chances you will be posted in let's say medicine, or in other branches as well. Medicine, OBG, depends on the requirement. In different setting you will be getting a seat to work for a very short period of time, 6 months to 1 year in these areas, right? So these are the other options which most of the students are doing, apart from the traditional one, which is diploma, NEET PG, INICT, right? Any of them. Alright, then as I was telling you that most of the students are also going for private practice. Private practice is never out of fashion. You can definitely continue your own practice. And when we say private practice, some of the students will be asking, sir, is it very easy? I would say, see, nothing is easy. Nothing is coming as a free lunch or free dinner. You definitely have to work your way out. And when it comes to private practice, you see, majority of our population are living in the peripheries, right? Not everyone is having access to major tier 1 cities. So most of the places you will be having tier 2 or tier 3 cities where you can definitely establish. The majority of the patient you are going to get in these areas will be having a common ailments like fever, right? They will be having common cold, upper respiratory tract infection. You will also be getting other patients like, let's say, diarrhea or UTI, right? Pharyngitis, the usual stuff, right? So around 40-50% of the patient on the regular basis are of these. Now, can you handle this? Why not? You have every necessary skill, you have learned every necessary drug to handle these kind of problems, right? But as far as the complications are concerned, or if you're getting some complicated cases, make sure that you refer it to the specialist rather than going ahead. So how can you establish a private practice in India? Just after finishing FMG, we have a definite video coming up on this step as well. As long as you guys want, you can just let us know in the comment section if you guys will be interested in any of this, and we can make a full video how can you establish, and we can guide you step by step that how can you actually continue in any of this pathway. Nowadays, I have also seen something in very much fashion. A lot of students, they are finishing their MBBS, they are getting their registration done, and they are doing diploma, a 6 months to 1 year diploma, let's say in diabetes, okay, which most of the students are doing. There are many, institutes, those who are offering fellowship in diabetes or diploma in diabetes. Do remember, this fellowship or diploma in diabetes is not recognized by any of our government institutions or any of the government examination. Neither AIMS or INICT or you would say NEET PG, any of the board examination, they are not certifying that. It's just a fellowship course you guys can do. You can write it on your on your board, and you can definitely practice that medicine, right? So fellowship in diabetes, I have seen a lot of students are writing that, and they are they have their association usually from foreign countries like from UK or from other countries like America, and they are practicing that as well. So can you handle OPD case of diabetes? Why not, right? Usual, look for the basic, right? You will learn basic skill. But I'm trying to say how to diagnose it, how to manage on the OPD basis, how to start, let's say, insulin, how to modulate the dose of the insulin. Everything about these basic, you'll definitely be taught in these areas. So that is also in fashion. So not only going for NEET PG or INICT, you also have private practice, you also have JRship. What else can a student do after finishing? Now when it comes to diploma, I have seen many students, those who have a desire of establishing their own setup at private practice. Let's say private practice, they usually go for diploma. They will be doing a 2-year diploma course, which will be paid an equal amount. During diploma, definitely you are getting paid. If you are doing from government setup, you are getting paid same as a NEET PG, right? A NEET PG resident and a diploma resident, they are getting paid equally. Okay? So within 2 years, your course will be complete. For example, let's say if you are going, let's say DGO, diploma in gynecology or obstetrics, or you are doing diploma in another area like ophthalmology, right? Or you can also do, let's say, any other like diploma in anesthesia, right? There are other diploma as well in different, like diploma in pediatrics, like DCH, diploma in child health care, right? You can do diploma in any of these branches, and you can continue to establish your private practice as a specialist doctor, right? Like if you are doing DGO or if you are doing DOPT or diploma in anesthesia, you can write yourself as a specialist doctor in any one of them. Okay? Depends. Now it depends. If you are taking that private seat through counseling, you will be getting paid, right? You will be getting paid. But most of the time, I have seen that when the students are taking the seat on money, they usually try to adjust their stipend in their fees. So their stipend is much lesser, like around 45 to 50,000, and they try to adjust these stipend with their fees only. So for example, if it is 50,000 in 1 year, it will be around 6 lakh. In 3 years, it's gonna be 18 lakh. So that 18 lakh, they usually try to reduce that from their fees. Okay? So from the private practice, do you get stipend? Yes, but most of the time I have seen students are trying to adjust that in their fees. Okay? Okay, so diploma is another thing that you can do rather than going for NEET PG or INICT, or if you're not interested in let's say directly starting your private practice, if you want to start, let's say a specialist, you can do that, right? All the branches, I think almost all the branches there is a diploma. There is a diploma in almost all the branches. Diploma in ENT as well. There is diploma in ENT as well. Okay. Now this is best usually, and they get equal recognition usually in everywhere wherever they are practicing. They have full-fledged specialist training, and I've seen many of times even DGO or let's say a DOF, they have a better patient care skill. They have the best, better OPD running compared to full-fledged, let's say MS Gynae or MS ophthalmologist, right? Totally depends on your skill, what you're learning, and how you're going to handle the patient. Remember that. Okay, what else? Do we have some other options, sir? Yes, we have some other options, sir. One other option that you have, that you can go for an integrated 6-year course. Now this is quite long. I mean, once you are getting inside, it will be quite long. 6 years, there is no coming out. In that, after MBBS, you will be entering and you will be coming out as a neurosurgeon, or you are going to come out as a plastic surgeon or cardiothoracic surgeon. Okay. So not all the branches, but few of the branches are having a 6-year integrated course, which is available only in few institutes, like through DNB colleges. Some of the DNB colleges are offering that, and that is quite impressive actually. AIMS and also NIMHANS, AIMS New Delhi, and also NIMHANS, which is also offering this integrated 6-year course, neurosurgery, plastic surgery, CTVS. So you guys can check it out, but just do remember that before choosing this one, make sure that you are having a a research about in which institute that you are going, whether you are going for a private DNB institute, or if you are going for government. Make sure you are also studying the record, the pass percentage and everything. Stipend after FMG. Now, according to the guidelines of the government, FMG intern should get paid same as an Indian intern, right? I repeat again, according to the guidelines of India that we have, intern of FMG should get paid quite similar amount as compared to the Indian medical graduate, those who are doing internship. However, some states are resisting it. There are some news that I have heard directly from the student. This is not official, but from the student we have heard that their state is having creating some trouble. But the guidelines are very clearly indicating or clearly saying that yes, they should get paid, right? So I think in the government setup they are getting paid around 22 to 25,000 per month. So upcoming days the acceptability will definitely increase, right? If in whatever states if they are not giving, definitely they should start giving that as well. Dr. Aditya Sahu, referring to your query. If you guys are having any other query, you guys can also just write it in between. Okay, for our FMG students, something that is very, very important, which most of the students are also opting nowadays. It's very satisfying, I would say, if you do not want much of the emergencies, if you do not like to go for the hassle and tussle of NEET PG. This is something that you guys should opt for. UPSC combined medical services, right? So coming through UPSC definitely may be a dream of many students. Getting into civil service may be a dream of many students, right? So you definitely have to qualify their entrance examination. So they have their entrance examination, and followed by there will be entrance as well. There is an entrance examination and then there is an interview. Okay, so पहले आपको entrance exam निकालना, then there is interview. But in spite of all the information that we are getting, do remember that in UPSC CMS, right, there are a lot of government seats in PHCs and CHCs and civil hospitals that are left vacant, because of lack of doctors. So in our country, you do not have any scarcity of getting into this permanent job. It's a very permanent kind of job. You can work in any of the PHC, CHC or in the civil hospitals. You'll be acting as a medical officer. Okay. As far as the pay is concerned, the pay is usually stable initially, and the rise is very, very slow. Do remember that. However, if you want to take a government job in hand and you want to do the PG, you can save your government job and you can still go for PG. Post graduation आप दोबारा कर सकते हैं. You can apply for a study leave. So there is a option for getting into study leave as well. Even after taking this job, you can take a 2 to 3 year. If you're taking a diploma, you can get a 2-year study leave. And do you know what is the advantage of that? You can take a study leave, and when you join, you'll be joining at the promoted level, right? Because you'll be specialist and you'll be posted at the level of the specialist somewhere. Okay? So the only thing is that it has an entrance exam and interview, and the good news is that it is not going to include all the 19 subjects. They'll be having mainly the clinical subjects like pediatrics, obstetrics and gynecology, surgery, medicine, community medicine, right? And there will be some question that will be integrated from pharmacology as well. So pharmacology is never going out of your scene. So most of the medicine question, or you can say gynae question, or even some of the pedia question may be associated with the pharmacology as well. So entrance examination, interview, and only 5-6 subjects will be there. So for this basic, they're not going to ask you biochemistry, physiology, or the rate limiting enzymes and all. No, those questions are not going to be there. Okay. Will they give salary during the study leave? Now, if you are getting a salary, if you are getting a stipend from the second position, let's say you are doing a government job and you are getting a salary of 1 lakh per month, and you have also joined as a resident and you are applying for a study leave here. Okay. If you are not getting paid as a resident there at any XYZ hospital, then you will be paid here. But if you are getting paid at one place, you will not be paid here. You will be paid any one place. Either you are going to get paid at the place of your residency or you will be paid here. In majority of the condition, as soon as you take a study leave, I have seen, according to my experience, the salary will stop and only your pay from the residency will continue. Dr. SGN, I hope your query is sorted. Yes. So that is also one of the option, UPSC combined medical services. A lot of students guys are opting, and it's not very difficult, believe me, it's not very difficult at all. Okay, you'll be working as at the level of officer, you'll be working with the government servants, and definitely the people from the police services, they'll be coming and they'll be giving you a salute. We have seen this, and it's a kind of job that if anyone loves the civil services or government job, they are going to get very satisfied. But if you are a person who loves like money, and if you want the fancy patients, those who are coming, doctor, I think there's a bee sting here and I think I'm gonna die, please give me some drug here, definitely that is not this job is not going to satisfy you, because here the most of the patient will be from the peripheries, and you have to handle the usual kind of stuff like sometimes hypertension, diabetes, but most of the time fever, upper respiratory infection, UTI, GI infection, diarrhea, like those kind of patient you'll be getting here. Okay, so this is another option that you can actually try. And if you want, we can have a separate video also how you can actually go for UPSC CMS. How can you join as army doctor? That is what I am going to come next, doctor. That you can even apply for as in the army as well. You can even apply, and that you can do definitely. You have AFMS, Armed Force Medical Services. You can apply for AFMS as well, Armed Force Medical Services. Right? I think my system has hanged again due to something. I have tried to transfer this PowerPoint from my iPad to here, and whenever we try to transfer anything from iPad, the acceptability is very less. So Armed Force Medical Services, by the time it is coming out of the hanging mode, will continue in the Armed Force Medical Services. Here you'll be promoted usually in the post of major, right? So jaise as you proceed in the job, your title will change, like major, colonel, and all those titles you'll be getting in the according to your experience. Do remember, for them also you'll have to write an exam, and you'll be joining as short service commission, right? You'll be joining as a short service commission. In this there will be a bond, right? So like in some places it is around 4 year, 5 year, 6 year. It is expanded up to a period of 15 years, right? So I'm talking about actually the AFMS. Let me just show the PowerPoint again. I'm having trouble, sorry for this, and it has never happened. This is the first time I'm suffering with this kind of problem. Trying to open again. Let's see if we can get lucky for 5-7 more minutes. Okay. So as I was mentioning to all of you guys, that diploma, UPSC CMS, and pay also I have told you, and this is what I was mentioning to all of you guys, that you can join as Armed Force Medical Services. Okay, you can join here as a short service commission. This short service commission is actually a bond period, right? But for entering into this one, again you have to write an examination. Remember, the examination is not very difficult. It is not as difficult as the NEET, PGI, and ICT or any of this examination that I have mentioned, right? Like lab, next कुछ इसके जैसा नहीं है बिल्कुल ये. It will be relatively easy, and you'll be getting here the patients also you are going to get here will be the usual kind of the army personnel, those will be having usual the general conditions which you have to handle. But the physical fitness is very, very important here. So if you are trying or if you are planning to join as AMFS, you can join. And in my experience, many of my students are actually working as this one, and they always message and they say, sir, we are very proud that we are called as colonel or general or major, right? And the other army personnel, they are coming, they are saluting us. We have getting, these are the different perks. We are getting this place to stay, and these are my vehicle, and these are all things that I have achieved so far. So they'll be writing every now and then we'll be getting their messages, and it's really very we feel very proud to read their messages. So if you are interested, definitely you guys can continue. Okay. Work life salary balance in various PG branches. Definitely Vicky, Dr. Vicky, I can definitely make a video. I have some content about that already. In upcoming days, definitely we can. Is it a state-wise exam or individual state exam? Rajat Tyagi, about which one you are asking about? Are you talking about UPSC? If we have eyesight, are we still eligible, sir? If we have eyesight, are we still eligible? Eyesight for which one? For AFMS? So definitely you need eyesight. I mean, without eyesight, how can you join? If there is poor eyesight, maybe that's what you're trying to ask, then there may be some medical issues, because for entering into that, medical fitness is very important. Now, another thing that I would like to discuss with all of you, which you can join as MBA or medical health administrative services, right? MHA, medical health administration में आप आ सकते हो, MBA. So here, if you're coming through CAT, definitely it will be a little competitive, but there are certain places, certain management colleges, those who are providing these seats on the pay basis as well. So nowadays, a lot of students, rather than opting for NEET PG and going into the hassle tussle of AIMS, I and ICT, they are opting for MBA or MHA as well. Okay? Now MBA, usually if you're going in the government colleges, right, you will be coming through CAT, right, and you will be getting seats accordingly. Apart from that, you can also do from private colleges as well. So you can do MBA in hospital administration. You can also do MBA in hospital management. In any of them, you can do a medical administration, also healthcare management, and also MBA in bioinformatics. A lot of students are opting for this MBA as well. Believe me, it's also very satisfying career job. You'll be working in the post of administration. Under you, one hospital, or let's say a chain of hospital, will be working depending on the skill that you have acquired, depending on your administrative power, depending on your experience, right? You may be asked to handle a hospital, a couple of doctors, right, or maybe a couple of a chain of hospital as well, right? So you can definitely try for this one as well. We can have a separate session on this as well, that how can you go into MBA, what are the colleges that you can go ahead, what are the government colleges. So some of the government colleges that I have enlisted here, I'll be telling you those as well. Apart from that, masters in health administration, you can also go for PGI Chandigarh is offering, AIMS New Delhi is offering, right? MBA in hospital administration, JNMC Jawaharlal Nehru Medical College, Aligarh Muslim University is also offering. Then you can also get in hospital administration through DNB courses as well. There are many DNB courses also, those who are providing you MBA in hospital administration as well. Okay? So MBA is also very upcoming branch, and you must have seen also some of your seniors must be doing it, and they are having a quite satisfying job. The only thing is that initially the pay will not be as per the expectation. Maybe if you're doing it from the private area, maybe the pay will be somewhere around 70-80. That depends again if you're joining a bigger hospital, but if you're joining a smaller one, maybe the pay can be a little lesser than this as well. Remember that. Okay. एक तो कंबाइन होता है, कंबाइंड मेडिकल सर्विसेज, दैट वन एग्जाम दैट यू विल बी राइटिंग फॉर ऑल इंडिया. एक पूरे ऑल इंडिया का होता है, ठीक है. स्टेट वाइज का अलग है, ऑल इंडिया का अलग है. नाउ दीज आर द डिफरेंट कॉलेज दैट यू कैन कंसिडर फॉर डूइंग MBA in health administration or MBA in hospital management. One of them will be your AMU Aligarh. IIMs, जितने भी IIMs हैं, ठीक है, IIT खड़गपुर, NIT Trichy, right, Indian Institute of IIFT. IIFT is another college that we have in Delhi that is also providing this MBA courses. Then Faculty of Management Studies also in Delhi. They are also providing this MBA courses. Apart from that, Xavier School of Management Jamshedpur, Jamnalal Bajaj Institute in Mumbai, and these are not the only institutes. We have many other institutes that are also providing. These are the top institutes that I have mentioned to all of you guys, right? Indian Institute of Foreign Trade. This is the one, which is Indian Institute of Foreign Trade. So they also provide the MBA courses in hospital administration and other health sectors. You can join their courses as well. Okay. So these are the different enlisting that we have. If you guys will be interested, definitely we can have a separate session for this as well. Okay. Okay, Masters of Public Health. This is also that will be quite similar to PSM. So it's like giving a NEET PG and taking a PSM seat and then doing a 3-year PG, writing your thesis and getting a MD degree in PSM and proceeding with the usual job. This one, MPH, Masters of Public Health, this will be especially for that one only, right? PSM, Preventive or Social Medicine. You can work in the administration. You can also act with the WHO depending on where are you going to apply. Not only that, if you have done Masters of Public Health, you can do it will be equivalent to PSM, and you can even join the colleges as well, right? Join college as faculty. ठीक है. You can also go into the research as well. Research में भी आप जा सकते हैं. This is also something very important. Masters in Public Health. Now this MPH was not very popular in our country. It was mainly done in the States and other abroad countries. But nowadays it is very much into fashion, especially after the COVID. We have seen a lot of MPH seats are open in Jipmer, DY Patil, or in Gurgaon. We have Shri Guru Gobind Singh University or other private colleges also. They are also offering your MPH seat. Okay. All right, then pharmaceuticals. Last thing that I can tell you, which you can also opt for, will be the pharmaceuticals, where you can work as a pharmaceutical reviewer, right? So you don't need to be MD Pharma, right? Usually, for the pharmaceuticals, they will be needing MD Pharmacology, but it's not necessary. MD Pharmacology will be required, but it's not necessary. Remember this. MD Pharmacology not necessary for joining these pharmaceuticals. As a medical reviewer, medical content writing, you should be very good with the content writing, and medical advisor as well, as a regional medical advisor. In this one, there will be a lot of traveling as well. As a medical advisor, you'll be meeting different doctors in the different health setups, or maybe you'll be meeting in different hotels and all, and you'll be promoting basically the product that if you're going to join XYZ company, you'll be promoting their product. So it's like I can say in a nutshell, if I'm not wrong, you'll be working as a very senior MR, right? So your work is not to go to every every doctor's chamber and meet. No, it will not be that. That meeting will be arranged by the MR. You'll be meeting them at a very decent place, and you'll be explaining your products, and you'll be telling you what are the perks the doctor can have, and what are the different options that they have, and how is it beneficial for the patients. You'll be basically promoting your own drug that you have got into. Okay? So these are the different areas that I wanted to discuss with all of you guys. Let me quickly take you through what all things that we have. that what are the different options. So this was the last thing that I told you. Pharmaceuticals, MPS, Masters of Public Health, definitely you guys can do. Why we are discussing this one? Because after coming, the students are actually clueless sometime after coming from foreign, and they're thinking, okay, what to do. We are not aware whether we should go for FMG, or if we have passed FMG we don't have any other choice, right? The NEET PG exam is very difficult. No, that's not true. You take any data, you simply do a little bit of your research, and you will realize a lot of NEET PG seats is now been taken by our FMG students. Do you know why? Because the exam level, the difficulty level of the exam is of FMG and NEET PG is quite similar. Their level, the pattern of question may be difficult, but the syllabus is almost same. So FMG student is reading 3 to 4 times before appearing for the examination, and they have to revise almost same content. 70%, 75% of the content is same in the FMG and NEET PG. Some difficulty level just increased in our NEET PG, that is just 20-25%, and that can easily be handled. So that is why a lot of FMG students are clearing a good seats in NEET PG. Like some of them are cracking the 6-year neurosurgery or CTVS seats, and a lot of them are also cracking the other medicine or surgery or other very top branches like gynae and all. Okay? So MPH was one other thing that I told you. And these are the colleges for MBA or Masters in Health Administration you can do. Armed Force Medical Services is something that you should think about if you love the army, if you love the name and fame, right? The major or the colonel title in front of your name. UPSC, the civil service, right? The easy PG job, definitely 9 to 4 kind of job, and you'll be having a lot of perks as well in UPSC as well. Integrated 6-year course, apart from INICT or NEET PG. Diploma 2-year courses. Of course, as I told you, very easy to settle down, and if you are planning for private practice, this is the best thing if you want to do a rapid specialization. Specialization very fast, rapid, right? Private practice again is never out of fashion. You can definitely do at any point of time in your career, right? And most of the students, what are they finishing? Their internship, applying for license, and this is just temporary kind of job. Do remember this: 6 months to 1 year, you can work as a temporary, learn skill, and after learning the skill, you can actually go for the private practice. This is what that you can do. Okay, these are the traditional step in India which most of the students are taking. Abroad, में multiple options that I have told you. And a lot of video we have made already in this channel about USMLE. In upcoming days we will have more videos on that. Without FMG jobs in India. Now when we say without FMG jobs in India, that will be a little difficult for you, but if you have started something, if you have started this FMG thing, or if you have taken the MBBS abroad, definitely you knew this, that today or tomorrow you will be writing this examination. How to clear this? And do you have certain jobs? A lot of students are working. They're taking. I have seen. On the basis of my personal experience, I'm telling you, they are doing. I think around 5 to 6 month course in the call center, like health related jo call centers hai. They are doing that training in that call center, and they are working in health related call center. So those kind of jobs, if you love a night shift, or if you want to settle in those kind of areas, definitely you can. And I have seen a lot of FMGs are also settling themselves in private practice in a sense with the private practitioners. So they are going to work as their helping hand, but they will not get recognition, this is for sure. If someone is doing some fake or fraud thing, that's a different thing, but you can work with some of the doctors as their assistant, as a doctor assistant, but just rest assured that you will not be getting recognition. You can earn some money, that is not that's unquestionable thing. You can earn some money, but you won't get the satisfaction that you actually wanted. As far as clearing the FMG is concerned, we will have a video how to approach. I have already made some videos about how to clear. Just remember that examination of FMG is not very difficult at all. This exam is not difficult, no. Why am I telling it's not difficult? If you have done just 2 to 3 hours of studies in your med school on the regular basis, right? How much I'm telling out of 24 hour. I'm not telling anyone who is studying 12 hours or 10 hours. I'm just telling just 2 to 3 hours, right? Many of you may be a second year, third year student, so you can start doing that. Just 2 to 3 hour focus study, and you already know the pattern. You already have FMG solution. You must be having FMG solution. You must be having, Unacademy subscription. You must start practicing the MCQs of whatever subject that you are reading. For example, if you are in second year, you must be dealing with patho, pharma, micro. So do these subjects, do their MCQs, so that by the time you are reaching to India, you have already done each one of these already, and now you have to do just the revision. Passing percentage in our FMG students has markedly increased, not in the previous, but previous to that, the passing percentage was more than 27%. That was a history. Compared to 3 to 4% earlier, now it has increased to 27%. And why it has increased? Because students have got the fact that it's not an easy cup. They have to start working, and they are working. It's the hard work of the students. We are just the guiding, elements. We are just guiding them that do this, don't do this, right? Do's and don'ts पे हम लोग बता रहे हैं. But सारे hard works तो आप लोग कर रहे हैं. All of you are doing those hard work, and you guys are more disciplined compared to our previous batches, and that is why the passing percentage has markedly increased. Right? You just have to act like medical student which is taking a seat in India, right? 2 to 3 hours का daily देना, बाकी time पे you continue with your classes or do whatever you want to do. But for this career, if you wanted to settle down early, you wanted to clear in a very first go, definitely you can, right? How to remember drug of choice and contraindicators because it's volatile? Any trick? Now when I say drug of choices, in most of the scenarios I have given you the list. If you have attended any of my pharma classes, Dr. Aditya Sahu, I am sure you have, then I used to give the list. And how can you remember for longer time? That is just a matter of revision, a couple of revision, and that's it, and you will be good to go. You won't be struggling with that kind of things. I mean, drug of choice is something that you will not struggle. Nobody has struggled so much, and you will not also. As long as the contraindication is concerned, most of the time I give the mnemonics, right? So that these are the stories, or mnemonics will definitely be there in my classes. So you can follow those stories or mnemonics to follow it out. Like for example, I used to say that what are the contraindication of ACE inhibitors, and I used to give the mnemonic as BPH is a contraindication, right? BPH आप याद कर लीजिए, so bilateral renal artery stenosis or pregnancy and hyperkalemia. So that is how you can remember with all the stories and mnemonic that we have in the classes, right? So with this, I think we have discussed our today's content. I hope all of you guys have enjoyed this, and all of you guys have got enlightened about the today's content. If you have any question, any doubt related to our content today, or if you want any of the particular area to be discussed in more detail, please write it to us in the comment section, and we'll see you in upcoming classes more. Thank you very much to all of you, and we'll see you in upcoming classes. Are we good to go? Yes, any questions? The student, those who are live right now, any questions? Dr. Aditya, Indu, I think I have clarified your query. Rajatyagi, GR, GS, Dr. GSN, all of you. Okay, if there are none, then we will call it a day. Next will be applicable or not. Now that is something which we all are waiting. A lot of confirmation is awaited from the authorities, and next will be there, but it's not coming in the upcoming 1 to 2 year. I don't see. Next year तो नहीं आ रहा, 2023 तक तो नहीं आ रहा, वो तो श्योर है. उसके लिए तो आई थिंक न्यूज़ में भी था. नेक्स्ट ईयर तो नहीं आ रहा है, तो अभी आपके पास टाइम है. बट नेक्स्ट आएगा कि नहीं, वो तो डेफिनेटली आएगा. बट कब आएगा अभी उसके लिए क्लैरिफिकेशन नहीं है, तो वी कैन नॉट कमिट ऑन दैट. वी कैन नॉट कमेंट ऑन दैट ऑल्सो. ठीक है. एनी अदर क्वेश्चन, एनीवन अपार्ट फ्रॉम डॉक्टर हार्दिक नेहरा? ठीक है, चलो, we have seen it, and thank you very much for your presence and attendance. Do let us know if you like the video, and if you want us to make more content on whichever topic that you like or you want. Definitely we'll try to come up with more research, more studies, and to provide you an easy study experience on the platform. Thank you very much to all of you. Have a good night.